What's up, everybody? Khaled Iwamura here from insaga.com, and I am back again with the Mayor of Brampton, Patrick Brown. Happy New Year, Merry Christmas, and all that fun stuff.
It's been a while, so yeah, Merry Christmas, Happy New Year. Welcome to 2022.
I know, we haven't talked for about a month and a half, so lots to talk about here. A lot of good questions from our Brampton viewers. Well, I got to ask, what do you think of the new restrictions that were imposed by Doug Ford on Monday?
Sort of feels like Groundhog Day. We're doing the same thing again and again, and I am disappointed. I have been encouraging the public to get vaccinated, to get back to normal, and after they've made so much sacrifice, to sort of feel that we're not seeing a different approach is disappointing. And so I've had some criticisms of the current lockdown, that it's too sweeping. You see recreation closed across the board. I think there's a public health consequence to not having an active community. We know there's a correlation with severe COVID cases, and there's factors that connect them. Obesity is one factor, age is another. I want our residents to be active and healthy. I'm not a big fan of online learning. I think that is a nightmare for parents and educators. And I'm worried about our small businesses that are struggling to keep their heads afloat. So this is a tough pill to swallow. And I just want to see our community get back on our feet.
Talking about the businesses, what do you think would be would suffice in regards to pandemic relief, in regards to these restaurants, these salons, these gyms? What kind of financial support do you want them to see today?
Well, I think that's the wrong question. Of course, the government has to help them and subsidize them when the government is shutting them down. But the government's had 2 years to create the environment where we didn't have to have a lockdown. They've had 2 years to fix this. And despite spending more than we've ever seen spent by government, we haven't created any new healthcare capacity. We went into this pandemic with 90% of our hospital beds in use. So we were in a very fragile position where the slightest uptick in cases could overwhelm the hospital system. And sadly, we're back at square one, where we haven't created the capacity. And so the easy, lazy approach is to have another lockdown. I just wish over the last 2 years they had invested in hospital capacity, so we wouldn't be in the same predicament.
True. Talking about bylaw officers, and I hate to bring this up again, but I mean, are bylaw officers going to be out in kind of talking to other businesses to make sure they're following by the rules, or is it more education right now?
So we've asked, at the beginning of the pandemic, we increased our complement of bylaw officers to help with the provincial emergency regulations and public health guidance. We have to abide by these provincial regulations. It's not like we can allow a restaurant to open when they're not allowed to. A provincial order supersedes a local one. So, bylaw has to follow the provincial regulations.
Okay. And I know this is kind of not within your jurisdiction, but they're all asking, when do you think schools will open on January 26th?
Well, I'm disappointed they closed schools in the first place. And so given the fact that they're delayed, it's anyone's guess. We've lost more school days in Ontario during the pandemic than any other jurisdiction in North America. I have spoken to the Premier about this. I've spoken to the Minister of Education. I've shared with them my frustrations. And if we see another extension of schools being closed, I'm going to be angry. I have spoken to parents who are in tears. I think there is a mental health toll to children not being in school, and there's a learning toll. You don't get the same learning experience online. There's an equity issue. Not everyone has the same access to technology. There's so many reasons we need to have children in school learning. And right now, if the province believes that they needed additional time to get air filters into schools, and if they need time to give education workers boosters, boy, they better be doing it. And I wish they had done that 2 summers ago, last summer. But if they say they need another 2 weeks on top of the last 2 years to make these adjustments in the school system, I'll be pulling my hair out.
You said you've messaged Doug Ford and Minister Lecce, and have they responded back?
I've spoken to them both on the phone. I wanted them to know my feelings.
Okay.
Yeah.
Earlier this week, you mentioned that the healthcare system in Canada is very fragile. What did you mean by that?
Well, we went into the pandemic with 90% of our hospital beds in use. We have one of the lowest percentages per capita of hospital beds and acute care beds in the developed world. And so we're in a position where going into the pandemic, we were almost full. You look at other countries, let me give you an example. Look at the US. They went into the pandemic with 64% of their hospital beds in use. In Canada, it was 90%. And, we go on talking about universal health care. Maybe we need an honest conversation about the fact that we don't have universal health care in Canada. We don't. You look at Brampton, a community where they haven't invested in the hospital capacity in the last 20 years, and we have half the beds per capita that is the provincial average. There are some communities that have adequate investments in healthcare, but if you look at growing suburban Canada, we don't have adequate healthcare capacity. And on a national picture, you look at our hospital capacity, it is so diminished compared to other countries that it's embarrassing. I want us to be proud of our healthcare system. We've got incredible nurses, incredible physicians, but we need to build that capacity. And we have shortages across the system, not just in ICU beds, but staffing as well. We have to do better. And I think if this pandemic isn't a lesson that our healthcare system is fragile, then boy, I don't know what is.
This week, you also said that in William Osler, there's 5 COVID-19 patients in ICU, and you think the coronavirus hospital reporting data is misleading. What did you mean by that? So
what my intention is to make sure that every briefing I get from Osler and from public health that I share with the public. I'm a big believer in transparency and accuracy. We can't treat the public like children. We need to treat the public with the same honesty and transparency that we'd expect in any other dealings in life. And so as I get data shared with me, I'm sharing it with the public. One of the justifications for the latest lockdown was that the hospital system was being tested. And so I felt it was incumbent upon me to share what our true critical care capacity is, to give people a picture of how close we are to teetering on the edge. The biggest challenges in our ICU capacity right now, it's staffing shortages. And then in terms of accurate reporting, I think it's important that we explain which patients are in the hospital being treated for COVID and which ones are there with incidental cases of COVID. So if someone is in the hospital requiring a ventilator, they're clearly being treated for COVID. But if someone goes into the hospital because they broke their arm and everyone gets tested in the hospital and they find out that they have COVID, they're not being treated for COVID. It'll be a very short hospital stay. And so, just sharing that the totality of that picture, I think that level of transparency is important for the public.
You've been getting a little bit of heat in regards to still going on with the New Year's Eve event in Brampton. Any regrets or anything, or no?
I haven't had any complaints sent my way. It's been relatively positive. I'm a believer that we should have outdoor events. And I know there are some who have argued to close outdoor amenities and close outdoor events. That's not the advice we get from Dr. Lowe in public health. And throughout this pandemic, I've tried to adhere to the guidance of public health. And when the provincial government closed playgrounds last year, I was the first mayor to speak against it. And I said, that's not supported by the science and the data. Public health was very clear that we can have outdoor functions because they are low risk and you don't see transmission in open air like you would indoors. And we followed all the protocols. They wanted a seated event. They wanted it to, if you wanted to continue to have fireworks, you could do so. What I find too often in politics these days is you have announcements based on optics. There were cities closing, canceling fireworks. Let me tell you this. If you're watching fireworks from your backyard, if you're watching fireworks from anywhere, there's not a risk of getting COVID. And that's really a decision based on optics, not based on the science, the data, and public health. And so I feel very comfortable that in Brampton, we have adhered strictly to the advice of public health. I've got a tremendous level of confidence in Dr. Lowe and his team at Peel Public Health, and we're going to continue to get advice from them on what are safe environments and what are not safe environments. And I'll say very clearly that for residents of Brampton that want to be outdoors, you should. I think it's great to get fresh air. I think you should continue to feel that comfortable going to our outdoor amenities and events. And we're going a little bit further. In Brampton, we've actually expanded our outdoor winter amenities to make it easier for residents to enjoy the outdoors, to get exercise, to get fresh air in a safe fashion.
Nice. Did Sam Roberts put on a good show?
He put on an awesome show, and he loves Brampton. He told me it's one of his favorite spots to perform.
Awesome. And lastly, what's the latest on the Bill 21 fundraising?
So Bill 21 is discrimination. It is an attack on religious freedom in Canada. And in Brampton, we began a campaign to level the playing field, to make sure that we have the resources to take this all the way to the Supreme Court. And we've had cities across Canada join in. Just today, actually, Victoria joined the campaign, but from Calgary to Toronto to Winnipeg to Durham. It's been beautiful to see Canadian cities unite and to say, we're not going to allow a foundational value for our country diminished because of political cowardice. You know, people don't want to lose votes. The political parties in Ottawa, all of them, Liberals, Conservatives, NDP, shame on them. They don't want to lose votes in Quebec. And so they are turning a blind eye to discrimination. And that's not the Canadian way. You know, the Canadian dream is, it doesn't matter who you love, where you're born, the color of your skin, what God you worship, that if you work hard, you've got talent, you've got determination, you can go after your dreams. You can pursue any opportunity. And the fact that that is being diminished in one province in Canada is offensive.
And last question, Mayor Patrick Brown, what are you doing to stay in shape during these gym closures?
Well, I'm going to have to find new ways to get some exercise. I do have a Peloton and a treadmill, so I'll have to use those. But I'm going to be sad that our indoor hockey and indoor tennis are closed. I love our recreational amenities in Brampton. I'm a frequent user of our rec facilities, and I know there's a lot of residents who share my opinion that it's frustrating. And let me give you an example. Tennis. You're 76 feet apart in tennis. You're not going to get COVID 76 feet apart. But when you have sweeping lockdowns, you know, there's no opportunities to protect sports where they are very, very low risk. And so, you know, I'm going to continue to share my perspectives with provincial decision makers on this. And I may be blunt with you, but I'm just as blunt with them on the telephone. And, you know, I just want to make sure that we don't diminish wellness in our community.
We 100% know as viewers that you are not shy in extending your opinion to everybody. So, all right, Mayor Brown, thank you so much. I'll catch you next week.
All the best.